I'm Justina, and today we're going to be talking about sustainable development and neglected tropical diseases from a One Health perspective. So, a few key topics for today. We're going to figure out what sustainable development is. A specific goal that we're going to focus on is good health and well-being, and then we're going to look at that from the context of neglected tropical diseases, or NTDs, and then we're going to wrap that up with seeing how it relates to One Health. So let's get started. So sustainable development, it might have been a term that you have heard before, or you might have heard the term sustainability, but it tends to it seems very broad and vague. So we're going to look at what it means really. In 1987, the Brundtland Report, or it was published also as a book called Our Shared Future, and it defined sustainable development as development that meets the needs of the present without compromising the ability of future generations to meet their own needs. Great. Now that's still a little vague, so let's look at it in a little bit more depth. Sustainable development has three aspects, and you might also call it the triple bottom line. It's kind of a play on the phrase that businesses use of just their bottom line. But the triple bottom line, or you might call it like the three Ps, are people, planet, and profit. That's the term that might get used in businesses. The term that might get used in institutions or organizations are the three Es, the environment, economic, and ethical dimensions of sustainable development. So the intersection between all three of those dimensions is what we call sustainability. Now, the United Nations has identified sustainable development goals. So these are targets for change by 2030. There are 17 of them, and they're all based on the principle of leave no one behind. So, for example, by 2030, one of our goals is to eliminate poverty or eliminate hunger. The one that we're focusing on today is good health and well-being. That's SDG number 3. So the goal of this one is to ensure healthy lives and promote well-being for everyone at all ages. Now, each of these goals have targets, because if I just say good health and well-being, well, what does that mean? How do I know if I actually met the goal? The targets help you define whether you've met the goal, and there are indicators that can help you measure that. For example, SDG 3 has a target that by the end of 2030, you can eliminate and the epidemics of AIDS, tuberculosis, and malaria, as well as neglected tropical diseases, combat hepatitis, waterborne diseases, and other communicable diseases. So the indicator for this is to measure the number of people requiring intervention against neglected tropical diseases. Again, the idea behind the Sustainable Development Goals is that they're not necessarily just the government's job or just an organization's job. Every individual, organization, businesses, and governments can implement the targets and use the indicators to measure progress. So if we look at neglected tropical diseases, let's figure out what they are. So they're a group of diseases that are common in low-income countries, and they're neglected for a variety of factors. So they tend to have long periods between the time that you're infected and the time of showing symptoms. Sometimes you might not show outward symptoms at all until it becomes a bit of a problem. In addition, they're also considered diseases of poverty. They're disproportionately found in isolated, underdeveloped areas, and you might think these are exclusive to low-income countries, but they can be found in developed countries as well, and particularly in clusters of areas where poverty is rampant. So yeah, misconception is that they're only found in low-income countries. They can be found in high-income countries and impoverished groups. Now, exactly what counts as neglected tropical diseases is a little bit up for debate. So the Center for Disease Control lists 13, while the World Health Organization lists 20. Something that these all tend to have in common is that they're pretty complicated. So if we look at this group of diseases, for example, these are helminth diseases, meaning that they're from worms. And a lot of these have complicated life cycles. So eliminating them means that you have to look at the life cycle of the worm in, let's say, a reservoir like dogs, or they might have something to do with the environment around us, such as the presence of a vector. So a vector is something like a bug that can transmit diseases. If there are lots of vectors around, that might give you a higher possibility of contracting the disease. If there are not that many around, the odds of contracting the disease are low. So these tend to be harder problems to tackle because they have aspects of animals, the environment, as well as people. Does that sound familiar? That leads us to our One Health approach. So in order to truly tackle these diseases, it requires teamwork among professionals from diverse backgrounds. So that is helping us improve well-being for people, animals, and the environment. So things like funding for disease surveillance and diagnostics are considered extremely important. So an example is some bacterial neglected tropical diseases are often misdiagnosed as other ones, like malaria. Things like the human-animal interface needs to be paid close attention to because, let's say, anyone who works closely with animals are going to be at the forefront of potential spillover events. Someone who works with cattle, for example, might be victim of hybridization between like cattle parasites and human parasites. So this can create a potential new zoonotic diseases that can jump from animals to people. We also need to take into consideration animal reservoirs. So a reservoir like wild dogs or feral dogs might be driving rabies infections in people. So taking into account not just the human aspect, but the animal aspect as well, ultimately improves well-being for everyone involved. And I think that's it for me today. So here are my references, and I'm not sure, how are we for time?
8 minutes, 50 seconds.
Good enough. All right, I'm happy to answer questions now.
Good job, Yusina. I thought it was a really beautiful presentation, very aesthetically pleasing. I thought the way that you broke everything down was very fundamental and very intriguing. I really have a passion for this topic, and I think it was really well done.
Thanks, Kylie.
Okay, yeah, I thought it was excellent. Question for you. You said spillover, but it wasn't explained. What does that mean?
Right. Excellent question. Thank you for pointing that out. Spillover is the term that we use when an animal disease jumps from the animal towards the human. If you kind of think of a cup If the cup is, filled with water, if you add too much, it kind of spills over into the surrounding area. So that's how I like to remember it. If the animal diseases are kind of put under pressure in certain contexts, they might spill over into the surrounding area, which is the humans that interact with them.
Nice. And another question, you said that the WHO, I think it was, had 20
Mhm.
In the list, and then the United States CDC had 13. Who makes the final decision on what's on the list?
That's a very good question. The World Health Organization typically has jurisdiction in claiming that a disease is eradicated or eliminated. So it's the World Health Organization that can look around the world and say, yes, there are no cases of this disease. That means it's been eradicated. Or they can look at one country and say, there's no cases of the disease in this specific country, so it's been eliminated here. Outside of that, though, there's debate on what can be considered a neglected tropical disease. So the CDC outlines its list, but it doesn't quite have the same power as the World Health Organization to say it's been eliminated or eradicated. The World Health Organization, it can have its own list, but that won't stop perhaps other scientists from saying, hey, you should add this and this and this. It's by no means, as far as I came across in my research, they're not the sole power on this, or they're not they don't necessarily have the final say on only these diseases count or those ones shouldn't count and these ones should. That's kind of a murky area, but the 13 that the CDC identifies are what are the ones that overlap on everyone's list. So it's the additional few that people kind of run into debates about. But yeah, I hope that answers the question.
Yeah, interesting. Thanks. I have another question, but I want to give the opportunity for Doris Abdullah to ask anything.
You did a great job, but
Thanks.
you spoke about helminth diseases and how they are from worms. So what's a protozoa?
Ooh, excellent question. Protozoa is what we call a single-celled organism. So let's make that a bit more clear. All living things have cells. Me and you, we've got many cells that make us a person. A dog has many cells that make them a dog. But protozoa, they're just one cell, and they can cause diseases. So one example is malaria. What causes malaria is a protozoan called Plasmodium. Took me a second there, but yeah, it's called Plasmodium, and that's what makes you sick. So some other ones that are considered neglected are ones called trypanosomes, for example. They can cause Chagas disease or African sleeping sickness.
Great. And Doris and Abdullah?
Justina, do they just count human diseases or animal disease too?
Can you repeat that real quick?
The list that you showed, that CDC and WHO, are those diseases of just of humans or of animals too?
Yes. All right. So they are diseases that humans can get. However, some of them can be zoonotic. So rabies, for example, is a zoonotic disease. Again, that's something that can jump from animals to humans.
Great. Doris?
So I guess another question is, what do you think is the best way to prevent spillover events from happening? Or what do scientists think about that? That's a good question. Preventing spillover events. So what I included was more along the lines of diagnostics and surveillance. So that is making sure that the things we use to diagnose our diseases are accurate as well as readily available. So one of the issues that we have with neglected tropical diseases is that they're in isolated areas where things like medical care isn't easily accessible. I think building the capacity for surveillance and diagnostics is really important in order to prevent spillover events from happening, because it's the first step to understanding the problem. So I think if we're not actually aware of the potential for spillover, we're never actually going to be able to detect it if it happens or stop it from happening, because we don't actually know that this can happen. So I think understanding the problems, getting the big picture of the problem and seeing where spillover might occur is really important to prevent it from happening.
Great. And Doris, did you have another one?
Yeah, just a follow up to that, I guess, what is the biggest barrier to scientists finding out the root of the problems like spillover events? Is it like the government's not seeing the importance of the issue, or is the public not as well informed about them as they should be? Or yeah, like what's holding back from these research projects going on? In the context of neglected tropical diseases in specific, there's social aspects. So this is a more emerging field of study. So things like leprosy, for example, people who have it kind of get pushed out to the fringes of society, exacerbating the issues they have in regards to accessing healthcare. So the social stigma is a big problem in that regard. Things like just marketing is also an issue with these diseases as well. So it's easy to say we're fighting against malaria, but it's a lot harder to say we're fighting against cysticercosis, right? So especially when these are considered things that are poor people diseases. So there's quite a lot of there's a big social dimension to combating these diseases. I'm going to leave it at that at the moment. So I think the social aspect is definitely an avenue that needs to be explored, which kind of ties into the economic aspect, although that like the economic cost is a certain, it'll cost money to put money for research funding, pharmaceutical funding. There's more payoff in terms of elimination of these diseases. You'll have more people who are suffering, like you won't have people who are suffering disability or long-term disability, chronic illness as a result of these diseases. So there's an element of, there's a social aspect that needs to be overcome, but if it is overcome, it will lead to positive outcomes for people as well as economic benefits.
Great explanation. And you touched upon something that I wanted to raise before, and I wanted to hold off to see if you were going to talk about this. This is a question for everybody, okay? Yusina mentioned branding. Neglected tropical diseases, it's 3 words. It's a mouthful. And it sounds from what Yusina has said that it's not necessarily in the tropical areas only. And how How would you convince others, say in North America or anywhere that's far away from the tropics, to care about this?
I'm just thinking on exact language to use, but I would really kind of highlight the impact of this, how the impact of NTDs can be so oppressive to different communities that it's practically impossible for them to have any prosperity because of the burden of disease. Are we, in terms of your content, your question, is NTDs relevant to that person, or we're trying to make it relevant to them? It's not happening where they are.
I was thinking the latter, but we could do either.
Okay. I think a big aspect of NTDs and trying to, what people have been trying to do is try to get people to be invested in it and provide more research and funding into it. And I think showing the economic burden globally, and how if one area isn't prospering, it does truly connect to you and impact you through a global economic system, then I think that that could be a very persuasive motive.
It was good to hit on economics. That was really important. Great. I know Fola had I had an idea too.
Like how we've mentioned that, or how you've mentioned that personal stories tend to touch more on other people. So it could be helpful to have stories of people that it's happened to before, to have people like more relates to it.
Great. Let's take that a step further. And that's the way my brain was going. So if we're seeing a problem somewhere else in the world, but it's not affecting us, it's not affecting our families, right? Because of just the fall of the cards. But you know what's happening. So what makes you care about other people is empathy. How can you get to increase empathy in people? You have to share stories, relatable stories. So think about in our culture, wherever we are on this planet right now, how can messages and emotions be shared on a big scale?
Like movies,
Yeah. What else besides movies?
like social media is kind of all over the place now.
Great. Let's keep going.
Books or like just radio, like other forms of media.
Yeah. What type of video?
Um, like a documentary.
Yeah. So movies, documentaries. What else?
Just kind of rolling on the different kinds of media, like audio, like songs.
Great. Maybe
A music video.
yes. And a lot of people, not a lot of people, not enough people, but there are different places around the world have some artists, some musicians have been funded to convey really meaningful messages to their local public through the arts, right? Through music. And What about television shows? Maybe that just shows my age. Here's a story that is true, and I think it might lead us to the next question that I have for everybody. I think it was back in the 80s, and there was a problem with drunk drivers throughout the United States. Really, really bad problem. And there was a very popular show named Cheers. I don't know if you're familiar with it, but it's a very old show. Cheers was very, very, very popular, and it takes place in a bar. And they always had this underlying message of, is there a designated driver? Or they had a poster on the bar's wall that said, call a taxi if you're too, if you're too far gone. The person who is responsible for getting this messaging across is now one of the top people in I don't know if it's medical school or public health school at Harvard. So he served as a consultant somehow he got involved in the development of episodes of Cheers, and through that messaging it just became a background story. Like, it's something that became normal for everybody to think, oh, are you a designated driver? So taking this one step further, it doesn't have to be, so subtle, but subtlety is nice, because if it's subtle, then you can have a message in a lot of episodes, for instance, if it's a television show. But how can we, as people who are now educated about neglected tropical diseases, educate others and make them feel like this is important, even if they don't live in an area of the world that it is an immediate problem for them?
Pardon me. If we do tell a story, then you would want to make the person who is probably afflicted to be a little bit more relatable to the audience member, just to show that we're all human, we're all the same, and this can impact us too. And going beyond that, also what's on my mind is bringing up climate change and how climate change has a big factor in the geographic distribution of neglected tropical diseases, and it's slowly encroaching on areas that that people who don't think they would have been afflicted can be.
Paula, go ahead.
Touching on what Skylar said about geographical distribution, I feel like migration is also a very big part of it, because even if it's not affecting someone who might live, let's say, in Germany, someone moving from, like, even if it's just a day trip from, like, let's say, France to Germany, could carry a disease and it could affect someone in Germany.
Yeah, Yusina, did you have something to add?
Kind of building on what Paula and Skylar have mentioned, like, it is possible to kind of start local. So it is like in the United States, for example, oops, sorry about that. Roundworm diseases are common in impoverished areas, and like they disproportionately affect racialized individuals, like racial minorities. So like messaging that says like, hey, this happens here might also help.
Great. And Doris and Abdullah?
I think as long as there's some sort of character created that is relatable, as Skylar said, and I guess somebody who like you can easily be sympathetic for, then whatever story that is being told can be more impactful. And the person, even if it's a fictional story, I guess if it's anyhow like based on a true story or something that's happened recently, then people tend to be more alert, or they'll look out for it more. So I'm just thinking about, like, this is totally unrelated, but like even disaster films, even though they're not entirely real, people, I think after watching it at least for a while, it still kind of sticks and you can envision that happening as a possibility. So it could get people to be more concerned at least about something.
Yeah, Abdullah.
Yeah, maybe we can use local influential peoples or local celebrities for short videos. And it would be more impactful if we can use affected people to share their stories.
Great. Right. I think that we're all on the right track. I think that's ultimately what the world needs, what we're saying. So now we have to figure out, there's so many different options, there's so many different types of media to put out there. One idea, there are so many ideas in my head that's flying around, and I want to hear from you if you think it'd be worth doing. One idea is to do a social media campaign, do another contest. We've had multiple contests in the past, and it's been always a lot of fun. It's really quite inspiring to see thoughts from around the world coming in and efforts from around the world. And the idea is to do a short video. It could be in cartoon form. It could be just with subtitles. It doesn't have to be, something very complex, but the message could be that this is what happens with a particular condition, a particular disease, and how it can affect families. Because I think the concept of family is throughout the world, right? That's what we have in common. Some people hate their family, some people love their families. It doesn't matter. We all understand what the idea of a family is. So that's one idea, and we could make it into, say, a 5 to 10 minute video, and then we could, for the winners, we could put that on the website, and also we can interview them and promote the winners. So that's one idea. Let's start there, and then what are your thoughts on something like that? Yeah, Yusina.
I think that would be, I think it would be really fun. Something I mentioned last week, and I forgot to, I'm going to send you an email about this, but I wanted to kind of turn everyone's presentations into a little mini like social media campaign, because I think we've all worked really hard on them, and it would be a nice exercise into turning that content into like bite-sized social media posts. So I think doing this would be kind of taking that one step further and getting other people involved into doing something similar.
Awesome. Yeah, Doris.
Yeah, I do like the idea, but I fear that there might not be enough people who are willing to do a whole full-length 5 to 10 minute video. I've seen several social media, for businesses at least, they like to do like giveaways. I'm thinking about like pet, like related supply stores, and they really like to do giveaways. And to enter it, they do either a short video of your pet or just a photo with a caption of a story about them. And I think more people like to participate in those because it's at no cost really, and it's really quick and it's easily shared. So yeah, just a thought.
Cool. Yeah, I like the way our brains are going. Any other ideas? How do you think? Yeah, cool. Go on, Fulla, please.
Like what Doris said, like not everyone might be able to make a full video. So maybe instead of a video, we could use posters. That one might be easier to do because you can just draw it by hand. Or yeah.
Nice. What do you think about how can we inspire and connect more people in the Lesson Leaders program together? Maybe what we could do is either randomize, put people together in the Lesson Leaders program who are from all these different countries and have them challenge them to see what's the most creative poster or what's the most creative, I don't know, fine 2-minute video for a contest. And that way we don't open up it to the world. We just open it up to the lesson leaders who we know are really motivated and care about One Health. What are your thoughts on that? Yeah, Yusina.
I like that idea. I think it addresses both like short media is, short and sweet, kind of, less is more usually works best. And it also addresses like the participation and engagement that we would like to see. So yeah, I like that idea a lot.
Great. Anybody else? I want to play devil's advocate. What are the pros and cons of this?
Logistics. So let's think about this. This will probably involve lots of emailing. You'll need lots and lots of emailing. Who will be dealing with the emails? That's one thing. And Doris, is this something that you want to put on your plate? So there's that. There's also, we could kind of flip that and be like, hey, how can we do this without emailing? Or can we? I don't know. Then there's like, we'll need a schedule. Someone needs to build a schedule. Like we'll need deadlines for certain things. Some people, there's also, how do we pair people in a way that they can actually connect? Like what if the only time someone's available is when someone across the world is working or something like that? There's also the chance of, these are new people who haven't met each other in a social context before. So maybe putting them right into a group project, essentially. Like maybe the dynamics won't be all that great, like that kind of thing. Perhaps. That's what I've thought of.
Yeah, these are great. Excuse me. These are great comments for sure. And if we don't think about it now, then we would definitely encounter them later. So that's why we're talking about it, right? I guess my question is, number one, is it something that would be of interest? Number two, who would lead it? And I don't want it to be Doris. She has too much on her plate. Number three, Yusina would definitely have to be involved in it because we're talking about social media. But number four, how can we engage the audience now to see if there's an interest in it? Should we take a poll or something like that? Is that possible on social media? I've seen that on LinkedIn as a possibility, but I don't know about others. Is there an interactive poll that we could do?
You can do it on Instagram. I don't know how to do it on LinkedIn, but I can figure it out. It's just more like and Facebook, yeah. Our target audience is going to be probably, I'd say, like, based on Doris's data, they'd probably be most active on LinkedIn or in Facebook, if I'm correct. That's where most people have heard of us, right?
I think it's usually LinkedIn and Instagram, I believe, but then most people come from ISOHA, and I'm not sure whether they got it from the newsletter or ISOHA's social media handles. So, yeah.
Okay. So really, it just means we don't need YouTube for this or Twitter for this.
Skylar, Fola, Abdullah, what are your thoughts? We can always make a of this. Keep in mind.
What was that?
We can always make parents in charge of this project.
I think it would be a big undertaking, but I think it would be very effective, especially with engaging our current certified lesson leaders when we don't really have many classes to be taught. It would a few more pros. One incentive for them would be promotion. If they are certified lesson leader, they obviously care about One Health and perhaps pursuing related career paths. And if we're able to, choose a winner and then promote their content, I think that would really draw a lot of contestants.
Great. Thanks for that, Skylar. Abdullah, yeah, any comments?
Yeah. I was thinking that there are almost 70 certified lesson leader, and if somehow we can manage to contact them, and then we can make like their responsibility would be to share every post of One Health lessons on platform like LinkedIn, Facebook, Instagram, so that more people can know about like the those who are in their contact. They would say new post, and like
Great. So, okay, let's whittle this down a little bit more so that we're a bit more focused. This all started with the neglected tropical disease discussion, right? What we could do maybe is focus on one, malaria, for instance. And our challenge to the participants could be, I'm thinking of a lot of different things. It could be, how do you explain malaria to a 6-year-old?
Malaria is not neglected, but yes.
Thank you. Sorry. Give me another one.
River blindness.
It's definitely not neglected. River blindness. Okay, thank you. So how do you explain river blindness to a 6-year-old? And that way it will utilize their skills that they have already been acquiring with how to communicate science to children. That's important. A challenge would be for them, make it interactive. So you know how our lessons have all of these different activities built into them? It would be, the challenge for them is build an activity that lasts for 5 minutes that can get the kids to laugh, to play, to have fun, but learn at the same time.
I just got an idea. I feel like this would work really well on TikTok because I know that there's a lot of like challenges or something on TikTok. So we could kind of start off with a video and say, hey, I'm like Justina from One Health Lessons. I'm going to explain river blindness in, I don't know, a minute and a half to a 5-year-old. I do my minute and a half and then I say, I challenge, or like, I don't know, how do TikTok challenges work? Someone like the next challenge is like, pick a neglected tropical disease, your turn, go, like something like that.
That sounds fun. Do you think we would actually, maybe that would be a good poll? See if we're doing that. But one of you would have to start that.
I am definitely not versed in TikTok, unfortunately.
Yeah, TikTok's banned here, sadly.
Maybe we can stick to Instagram then, because yeah, that way, like I didn't think of that. It's more inclusive. I don't think Instagram is banned anywhere.
Instagram's now owned by Facebook, but I think Facebook's everywhere. Is that right?
All right.
Okay. Yeah. So let's explore this idea. Who wants to help Justina with this? Skylar? Awesome. There you go. So at our next meeting, could you pitch the idea, and Paris will be with us, Maddie will be with us, and we'll see how far we can go. Awesome. This is going to be really exciting and an awesome summer project for people. Plus, I think it will benefit the people watching this. Awesome. Great.